So this is my presentation on leukemia. Leukemia is a cancer that starts in blood tissue such as bone marrow and causes large numbers of abnormal blood cells to be produced and enter the blood. These are the classifications of leukemia, which are how fast leukemia progresses. Acute leukemia is the first one, which is where the abnormal blood cells are immature blood cells. They can't carry out their normal functions and they multiply rapidly, so the disease worsens quickly. Acute leukemia requires aggressive, timely treatment. The next one is chronic leukemia. There are many types of chronic leukemias. Some produce too many cells and some cause too few cells to be produced. Chronic leukemia involves more mature blood cells. These blood cells replicate and accumulate more quickly and can function normally for a period of time. Some forms of chronic leukemia initially produce no early symptoms and can go unnoticed or undiagnosed for years. Now, these are the other types of classifications of leukemia, which are the ones where blood cells are affected, the white blood cells. Lymphocytic leukemia affects the lymphoid cells, which form lymphoid or lymphocytic tissue. Lymphocytic tissue makes up the immune system. And then the myelogenous leukemia is where it affects the myeloid cells. Myeloid cells give a rise to red blood cells, white blood cells, and platelet-producing cells. So the types of leukemia are acute lymphocytic leukemia, acute myelogenous leukemia, chronic lymphocytic leukemia, and chronic myelogenous leukemia. So ALL is the most common type of leukemia in young children, which can also occur in adults. AML is also a common type of leukemia, which occurs in adults and children. AML is the most common type of acute leukemia in adults. CLL is the most common type of chronic adult leukemia, which you may feel well for years without needing treatment. And then CML is mainly affects adults. A person with CML may have few or no symptoms for months or years before entering a phase in which the leukemia cells grow more quickly. So the symptoms of leukemia vary depending on the type of leukemia. Common signs and symptoms include fever or chills, persistent fatigue, frequent or severe infections, losing weight without trying, swollen lymph nodes, enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds, tiny red spots on your skin, excessive sweating, especially at night, bone pain or tenderness. Next is a statistic I found, which was 456,481 people are living with or in remission from leukemia in the U.S. I actually found this statistic quite surprising because the number was so big. So some risk factors for developing some types of leukemia include previous cancer treatment. So people who've had certain types of chemotherapy and radiation therapy for other cancers have an increased risk of developing certain types of leukemia. Genetic disorders, genetic abnormalities seem to play a role in development of leukemia. Certain genetic disorders, such as Down syndrome, are associated with increased risk of leukemia. Exposure to certain chemicals, such as benzene, which is found in gasoline and is used in the chemical industry, is linked to increased risk. Smoking, such as cigarettes, increases the risk of acute myelogenous leukemia. Family history of leukemia. So if people in your family are diagnosed with leukemia, your risk may increase. However, most people with known risk factors don't get leukemia, and many people with leukemia have none of these risk factors. So some common treatments used to fight leukemia include chemotherapy. Chemotherapy is a major form of treatment for leukemia. This drug treatment uses chemicals to kill leukemia cells. Targeted therapy which is drug treatments that focus on specific abnormalities present within cancer cells. Radiation therapy uses X-rays and other high-energy beams to damage leukemia cells and stop their growth. Bone marrow transplant, which is also called stem cell transplant, helps reestablish healthy stem cells by replacing unhealthy bone marrow with leukemia-free stem cells that regenerate healthy bone marrow. Autoimmune therapy uses your immune system to fight the cancer. And then engineering immune cells to fight leukemia, which is a specialized treatment called CAR T cell therapy, which takes your body's germ-fighting T cells and engineers them to fight cancer and infuses them back into your body. And then clinical trials are experiments to test new cancer treatments and new ways of using existing treatments. Fun fact on clinical trials, my grandpa actually was used in one for his kidney cancer. So the next one is on how to prevent leukemia. There are no known ways to prevent leukemia, but there are some lifestyle changes that may help reduce the risk. So avoiding tobacco is a big one in cancer at all. And then maintaining a healthy weight. Being overweight or obese may increase the risk of leukemia. Avoiding exposure to chemicals like benzene, formaldehyde, and pesticides. Formaldehyde is found in pressed wood products, air fresheners, wallpaper, and permanent press clothing. The next one is where nutrition comes into play, which is eating a healthy diet. Eating a healthy diet rich in fruits and vegetables and low processed meats helps prevent leukemia. Being physically active, which is trying to be physically active every day. The standard is normally about 60 minutes a day. Be aware of family history. Discuss these with your family and a healthcare provider. And limit exposure to radiation, which is like CT scans, X-rays. And if you have any questions about this, just ask your healthcare provider because they will know more about it. And then lastly, these are the resources I used. I got a lot of my information from Mayo Clinic. And so this concludes my presentation.